Medical is one of the most important topics we can discuss when it comes to community aid or response, yet it's not talked about enough because it's not a cool guy skill. Yet your capabilities, your skill, and the gear that you carry can be the matter of life or death for a loved one or a member of your community whenever you're trying to help. So today, in part 3 of the Modern Minuteman series, we're going to be talking about medical skills, training, and the gear that you can carry. As a disclaimer to this video, guys, this does not serve as legal advice in regards to medical treatment, nor is this video really targeted at my EMTs, paramedics, nurses, physicians, and all of those certified individuals. Today, we're going to be kind of talking and gearing this more towards the average person and the general, person that makes up a Minuteman group or whatever type of community organized group that you may have in mind or are a part of. And there's some really big distinct differences between those two groups of people. Though it is absolutely great, and I really implore you to try and recruit different types of medical professionals into your group to add that capability, it's not always going to be there. It's not always going to be something that you can rely on. So you must start to look within to develop your own skills and capabilities. But first, guys, please like, comment, subscribe to the channel. Please show some support and love. Help us out in the algorithms. Check out our website, because even though today we're talking about medical, we have some class dates for our own medical response 1 classes here in 2023. So please give that a check. So let's talk about medical. Medical is going to really be determined by your skills. Gear is great, but if you don't have the skills to go with it, none of it is really going to matter in the end. You can have the highest of speed medical kits and trauma kits and all these different types of things, but if you don't know how to truly use them in a proficient manner, it's not going to matter. There are tons of different options for medical training. You could go to, like an EMT class, which is very, 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 very beginner level stuff, for 2-3 nights a week for like 6 months, and then you can become an EMT. Now you have a secondary, job option, but that's not something that a lot of people are going to do. It is a big time commitment, and normally you have to put the finances up front. So what are some other things that you can do? I talked about this recently with Justin from Archangel Tactical Medicine on the Everyday Citizens Tactical podcast, and the 3 biggest classes or skills that you can kind of invest into, I think, that makes you a more well-rounded person when it comes to being able to provide medically, is a good CPR class, because you are more likely to use CPR in everyday life than you are ever going to do anything cool guy. Grandma can fall over and go into cardiac arrest, Uncle Tom can have a heart attack, whatever it may be. Those types of skills are important. So a good CPR class, a good stop the bleed or trauma class, and a wilderness first aid class. That last one, that wilderness first aid, I talk about that one specifically because you get a really good understanding for the basics of first aid in that, but you also add the wilderness aspect to that, which will have a lot of environmental and natural injuries that come along with that. When we talk about the Minuteman concept or whatnot, we're talking about being outside, being in the field, being in different environments and all of that. So those types of skills will carry over to a multitude of places. That is a really good defined, base to go from, and that foundation will help you build from that. But let's talk about what everybody else is probably waiting for, which is going to be gear. Depending on the SOPs or guidelines of whatever group or organization you're a part of, a lot of this may be dictated by that, but we're going to go over just some general thoughts or guidelines for this kind of stuff. So obviously, if you have kit, you should have some sort of standard trauma IFAK already on you. And this can come in a multitude of ways. You may get something like this Haley Strategic dangler for a plate carrier or a chest rig, or you may go with something like a belt pouch like this T-Rex Arms IFAK with a kind of rip away pouch or whatnot in it, a little basket. A lot of these are going to be great whatever you go with, guys, but you have to have medical on your person. And your IFAK is not for treating other people. It is for people to be able to treat you during a life-threatening emergency. So, what makes up the standard trauma IFAK? You know, there are not necessarily a standard set of rules. However, what we have come up with here at Everyday Citizens Tactical is our own trauma IFAK, and this is made up of complete, quality North American rescue gear. It has a cap tourniquet, a 4-inch trauma dressing, a twin pack of chest seals, wound packing gauze. You can either use standard gauze or a hemostatic agent. That is for a different video. We will not be discussing that today. A nasal airway, triangle bandage, space blanket, shears, a Fox eye shield, gloves, and a little thing of duct tape. And then I also have casualty cards attached to the back of our IFAK. You can find these on our website, guys. This gives you everything you need to treat somebody using the March algorithm. And, people like to do, different things with their medical, but there should be a defined standard that is set. I carry more than just the one tourniquet that is in my actual IFAK. I normally have minimum of 2, normally 3 tourniquets on me at any given point in time if I'm wearing some sort of gear, unless I'm just at the range and just wearing my belt, then I'll normally have, 1 or 2 on me. Other things that you need as your personal medical gear, boo-boo kits. Something small that you can put into something like a day pack. If you have a large sustainment pack, a 3-day ruck, something like that, this may get a little bit bigger. Some common things to keep in this, guys: Band-Aids, small gauze rolls, little packets of triple antibiotic ointment, hydrocortisone cream, moleskin, just really small stuff, because the tiniest little cut or abrasion can become deadly if infected in the field, because a lot of people don't realize how dirty you really get in different environments over a prolonged period of time. So make sure that you have some sort of boo-boo pouch aside from your trauma IFAK, wherever that may be staged. Now we talk about capabilities, and moving along with capabilities is what you bring to the table as your group or your organization. I always tell people that are starting some sort of, volunteer community group, whatever that may be, their own Minuteman group, that you should establish some sort of group fund. Everybody throws in $20, $25 a month. This helps you accomplish group tasks that you normally might not be able to do as an individual. And one of the biggest things you can use that group fund for is medical gear. Now, one of the first things that you can do is create some sort of field medic bag. You can find a review on this bag and the contents that I keep in here for the general group somewhere on the screen here. And, a group field medic bag should not just be a giant IFAK. That's not what this is for. Those have other, purposes. But this bag should provide higher capabilities as far as medical gear goes. And the thing about that as civilians, let's even say the non-trained professionals, non-EMS individuals, there are some things you should not be doing. You should not be, randomly starting IVs in the field and trying to give fluids or putting eye gels down people's throats and whatnot. If you're not trained to do that kind of stuff, and the situation is really going to be dependent with that, don't do it. But for a medic bag, you can still provide some sort of higher capabilities. It could be, having a plethora of over-the-counter medications with instructions and dosages that you can get to your guys. Anti-diarrheas, stool softeners. Say you're, doing some sort of community response, and Sandra, the 78-year-old woman who just had her house blown away by a tornado, is having chest pain. Now you have aspirin. Whatever that may be, provide some sort of higher capabilities. This could be some minor airway stuff. This could be splinting gear. All that kind of stuff, guys. In addition to that, you may want to look at creating some sort of bag that is used for a mass casualty incident. I have this old butt pouch or kind of oversized fanny pack here from when I was in the Marine Corps that is full of just first aid and trauma gear. This is specifically for some sort of community response where I'm expecting a lot of trauma injuries, something like that, something I can pull a lot of resources for and bring it with me. And I'm not really worried about providing that higher capability of care, or maybe at least not right off the bat. Things like this, guys, are gonna be really good. You're going to want to define your purpose, figure out what skill sets you have, and go from there when it comes to creating bags. But bags are gonna be one of the most common things that you'll use. Medical is a huge aspect to the community aid portion of all this. Now, let's talk about transportation. As far as moving patients, casualties, whatever that may be, we have a few different options that you can invest in as the Minuteman. You can do something less expensive, like this North American Rescue Quick Litter. Comes in a vacuum sealed pouch, opens it up, and it's kind of like a giant tarp with handles. And you're able to move patients and casualties somewhat easily. I've used these in the past. These are really good, they're efficient. You get a couple of big strong boys on each corner, you can move somebody in no time. Or you can go with something a little more expensive, however, very useful and can be used time and time and time again, so long as it's taken care of. Field stretchers. This is the North American Rescue Talon 2 collapsible stretcher in its carrying case. This was a bit more of an investment, guys. However, this is a great capability. Comes with a carrying case. A guy can put this on and take this with him wherever you need to go. Maybe it's an aid and litter team during some sort of mass casualty response, whatever that might be. You have the capability of moving patients over and over again. Regardless, guys, medical is going to be something that kind of needs to be defined in a more serious fashion. Defining what type of gear your guys should be carrying at a minimum. Maybe if you have guys that have designated vehicles that are meant for supporting the operations, them keeping some sort of pack or box or kit in their vehicles to aid others or aid the team, whatever that may be. Find ways to advance your capabilities as a medical care provider for your community. It doesn't take, just EMTs and paramedics on an ambulance to go to what is probably going to be an overcrowded hospital to do all of this. I work in the fire and EMS field. I can tell you that resources are stretched thin. People are getting, stressed due to call volume. Hospitals are packed. Resources and the supply chain is stretched thin. You need to have a plan to be able to provide for your own families and your communities. And this can go much higher than all of this. You can learn, different types of natural ointments and remedies that you can harvest from nature through foraging or growing in a garden. You can, learn to do sutures and stuff like that. There are things that you can do, things that you can learn. And it is a process. You're not going to learn everything overnight, but you should continue to advance your own capabilities time and time again. And as I always say, guys, investing in quality medical gear is of the utmost importance. What is somebody else's life worth? That's all I've got, guys, for part 3 of the Modern Minuteman series. Anything I have on my channel as far as medical gear review goes, I'll put in the description down below. You can go find that. There are a ton of good resources on YouTube and on social media for learning about medical gear and medical skills. One of my favorites is Euromedics on Instagram. The Prep Medic here on YouTube has a ton of really good stuff as well. There are a ton of good channels, guys. All you have to do is try to learn. But at the same time, I also implore you to invest into some classes and go and learn as well, because you can only learn so much through a screen. You have to learn something in person, get your hands dirty, do the things. That's all I've got, guys, for part 3 of the Modern Minuteman series. As always, train hard, train often.